Hi, I'm Chris Lockard, and this is my integrative review on metered-dose inhalers, an alternative to nebulizers. This project started with the PICO question of, in patients requiring inhaled medication administration, is the use of a metered-dose inhaler with a spacer versus a standard nebulizer an effective alternative? Rural family nurse practitioners routinely assess and evaluate patients with medical diagnosis of chronic obstructive pulmonary disease and/or asthma. These two medical diagnoses have no social or economic barriers and consist of both adult and pediatric populations. The Center for Disease Control and Prevention identified 18.7 million adults and 6.8 million children diagnosed with asthma. 6.8 million adults are diagnosed with COPD. 294,000 ER visits listed COPD as their primary diagnosis in 2010. In that same year, 1.8 million ER visits listed asthma as their primary diagnosis. In 2010, there were 14.2 million primary care office visits that listed either asthma or COPD as their primary diagnosis. In this integrative review, I looked at 5 published peer-reviewed scholarly articles and included both qualitative and quantitative studies that had been published within the last 5 years. All studies utilized convenient sampling. The studies were geographically dispersed across the globe. 2 of the studies were performed by the same authors for replication, and study designs included retrospective chart reviews, randomized clinical trials, and post-intervention interviews. Sample sizes range from 50 to 330 participants. Data results documented in these 5 published studies yielded a large amount of data. Data synthesis directly applicable to the evaluation of the efficacy of metered-dose inhalers with spacers compared to nebulizers was divided into 2 primary categories to answer this specific question. 1. Data that supported metered-dose inhaler with spacers as effective. This was identified in 2 primary areas. 1, measurable data related to specific lung function parameters, such as peak flow rates, and lengths of stay in emergency departments. The second broad category was data illustrating patient and staff satisfaction with metered-dose inhaler with spacer use. Improving nursing practice. How can this improve nursing practice? Well, the advantages of a metered-dose inhaler for nursing practice is no power or maintenance requirements for the device, reduced costs for the provider and the patients, and convenience and ease of use. And we know that most patients are prescribed inhalers for home use. Education of patients and staff centered in the adult learning theory promotes the successful use of metered-dose inhalers with spacers. Clearly identify the benefits of MDI with spacers over nebulizers when doing staff and patient education. And patient and staff teaching plans should include summarize qualitative and quantitative data supporting the metered-dose inhaler use, such as that found in these 5 articles. And with any type of implementation of a new therapy, demonstration of proper use with validation of learning is important. Advantages of metered-dose inhalers for primary care, acute care, and home administration of aerosols medication is documented as equally effective as traditional nebulizers. There's no power or compressed gas requirements. There's potential for reduced cost for the provider and the patient. The convenience and ease of use, because they are portable and they can be used discreetly. And then the availability, as we know most people are documented or are prescribed metered-dose inhalers for home use. That concludes my review, and my PowerPoint presentation will be presented. And if you have any questions, please feel free to type them in the question box, and I will get back to you. Thank you.